Rachel, and good afternoon. I've got the uplifting subject of chronic disease just to wake you all up after lunch, and I'm going to start with a pop quiz and ask you who in the audience would like to hazard a guess as to what the leading cause of death in Australia is. Dementia in some age groups, yes. What the other ones? Any other? Heart disease, number one, big tick. What's the second? Cancer. Oh, you're right on the ball. What about mental health? Did you know that the leading cause of death in Australians between the ages of 14 and 44 is suicide, which is a damning indictment on a health sector while being extremely efficient and one of the best in the world, staffed by fantastic health professionals that are dedicated. We're not doing things right for a lot of people in Australia. So there's a number of problems that Episoft is designed to solve. So let's look at the cancer patient journey as an example. We'll come back to mental health because I can't really fit that on the slide. But the patient in the middle, and you have healthcare professionals in the community and in the hospital. So when you've got serious chronic illness, you've got the problem of falling through the cracks between hospital and community care. So let's take the relatively simple process of ordering a treatment for chemotherapy. So the patient sees their oncologist in the rooms and they talk to the doctor's receptionist, who then coordinates the appointments for the patient in the rooms. And then they have to talk to the hospital, and it might involve a clinical trial coordinator that needs to be talked to about when the patient can come in and be consented into a clinical trial. The hospital admin staff get involved in trying to coordinate the chemo with the doctor's appointment, so they talk to the doctor's receptionist again. And the pharmacist gets involved in ordering the drugs for the chemotherapy, and then the nurse then has to deliver those on the day and have a look at the test results and coordinate discussions with the doctor if the test results don't indicate that treatment can go ahead. And so all of that adds up to a lot of different communications, faxes, phone calls, and worst of all, transcription errors potentially between the hospital system and the doctor system as to what medications are going to be delivered. So as I said, you can't really do mental health like that on a single slide. Now the Episoft platform, in contrast, is a cloud-based patient-centred care platform that the users are the health professionals and the admin staff, and it's designed to coordinate that care across community and hospital for the people with really serious chronic illnesses like the ones I've mentioned. And so everybody in that platform is on the same page for what's going on with that patient, and all of the different players can come in at different points as needed. And so the value of it is delivering improved efficiency. So we do have medical record, which is so if you say there's a meat and potatoes piece you have to do for health records, which is the medical record and the administrative part, we do that. But the secret sauce we add on top of that is a treatment plan or a library of guidelines that health professionals can then change and customise to their own use, so that then they can track that patient's care over a longitudinal journey. And so they deliver the prescription, which is a plan on a page that then automates the process for the admin staff, the pharmacists, the nurses, and so on. And so the value of that then gets rolled up because they're all in the same database, but they've got secure partitions for each organisation using it, and they can then extend the care to other organisations in the Episoft community and start pooling data for analysis and amplify the research power of what the treatment is and how effective it is for that patient. So I used to put a slide of our various corporate logos because we do have very good traction in the market. We've got some blue chip customers. Our main customers are private hospitals, but we also have public hospitals and some community care agencies using Episoft. But I've changed that and just said what the users are saying. And so there's a lot of them that are saying, I love Episoft. So that's a really good accolade from people that are using the platform. And so I've got some photos of one of our sites going live with our cancer platform at a private hospital there. And the team is experienced, so Michael and I have been in the health IT industry all of our working lives, and so we started Episoft with a view to trying to bridge that gap between research and clinical care that seems to be missing at the moment, and backed by a great team covering technologists, domain experts, clinical domain experts and sales and marketing. And I apologise to two of my colleagues that are here with me today. They're not actually on the slide because I couldn't fit them, and they're new to the business. So yes, we can scale. So we've got major traction in all of the chronic disease verticals that we've targeted, and we're growing our ratios of current revenue, and we've just raised $1 million in capital to scale our sales. Thank you. That was